Well, let's go ahead and get going. Just to honor everyone's time, thank you so much for joining us today. I am super excited to present today's information. I hope that it is very actionable and helps you kind of understand the lay of the land and know exactly where to dive in and where to focus your efforts on. We are going to flip through a little bit of housekeeping types of stuff to get started, and then of course we'll get going. For right now, if you aren't wanting to say anything, if you'll make sure that your microphones are muted, you can always unmute yourself if you have a question or comment throughout as we go throughout today. But definitely, if you don't mind paying attention to that for us. Of course, information. We cite our sources and pull all of that. If you want to use our slides, just reach out to us. We would love to share them with you. And everything will be recorded and available on YouTube and on our website and all that stuff after today. So please feel free to check out all of that information. Just briefly about us, we've been around since 2007 here in Arizona, helping support health and human services. We've got a network of experts with a variety of backgrounds, but most folks have about 20 years of experience working either at the state in managed care or running large provider organizations of all shapes and sizes. So, of course, feel free to reach out to us if there's ever anything that we can do. We also do lots of fun stuff, and I've been saving this for the end of presentations, and then I run out of time. So I would put it at the beginning. So we are doing our best to bring health and human services together, and we're doing that in a number of different ways. So actually, next Friday, we're hosting a Coffee and Connection networking event. Coffee's on us. We would love to have you come join us. The coffee shop's right at 7th Street and I-10, so super centrally located. Please feel free to come on out and say hi on your way into work. Come late, leave early. Very happy just to shake your hand, say hi, and get to know you a little bit better. We also do volunteering once a month. So next Tuesday, which is the 13th, we're going to be volunteering down at St. Mary's Food Bank. And then in February, we're going to be having a happy hour. So if you want to dive in, please check out our website. We're always filling it with new information and new fun stuff just to kind of bring people together and help us all support one another. We also are continuing our webinars. So once a month we do this, our free power hours. So next month, we're going to be talking about Arizona's health transformation. There is a lot going on in Arizona right now, and it's a lot to track. So we're going to give you the rundown of all of the biggest, latest, and greatest things happening. And then in March, we're actually going to be launching a new way for providers and for professionals to connect with us. We're going to be launching a group coaching program that we're calling Mastermind Communities. So we're starting with two different topics. The first one being behavioral health clinical records documentation. And Alexis Santiago, who's on our team, she's here. She's got super strong background, LMSW, CPHQ, and it's going to help your clinicians, your paraprofessionals, BHTs, BHPs learn how to document better. We know that that impacts compliance, that impacts prior authorizations and cash flow. So recognizing that opportunity, we're going to do some group coaching, which makes it super accessible and affordable for folks to participate. So we're excited to do that. And then I'll be hosting a mastermind community that focuses on business growth and sustainability. With all the volatility, we're really having a look at our cash flow. And so I'll be working with organizations to help them identify where those opportunities are to stabilize, diversify, and help them get through the time that we're in right now, and making sure that we can ensure and protect that access to care. So get on the website, check those out. Very excited to offer that. I'm not going to go through my whole resume, but today we're here to talk about AI. And so I at least wanted to articulate that I do have credentials in this area. So in addition to all of the health information technology work that we've been doing for the last 20 some odd years, more recently, I am a member of the Harvard Business Review's Advisory Council, and I've been helping them work with different experts and leaders in publishing what best practices exist on artificial intelligence and how that impacts businesses as well as health and human services specifically. I'm also a member of a national group called the Safe AI and Medicaid Alliance. This is facilitated by OpenAI, which most folks are probably familiar with, the creators of ChatGPT. And we're working on creating ethical standards and values and guidelines that will be shared by all healthcare organizations and AI developers. So it's a really cool kind of partnership and collaboration. And then I'm also a member of the Coalition for Health AI, which similarly really looks to promote standards, governance, and support as we integrate artificial intelligence into health and human services, which is exactly what we're here to talk about today. So today we're going to be first doing very rudimentary stuff just to make sure that everyone has like shared language and a shared understanding. So we're going to talk about what is artificial intelligence. We're going to talk about how AI can build organizational capacity, which will be a brief conversation, but definitely I think there's some insightful little things for us to call out there. And then I'm going to go big and talk about, what's happening in AI. There's a lot of noise, specifically around how that impacts health and human services and, employment and jobs and the workforce and all of that. So we're going to talk about those current trends. We're going to go through a list of use cases so that we can kind of tangibly unpack, like, well, what can I even use this technology for? Helping folks really illuminate where those opportunities are. And then we're going to cover a roadmap for how you as an organization might be able to start implementing artificial intelligence safely and with confidence today. So hopefully y'all will find this discussion meaningful. Of course, the chat box is open if you have questions or comments. We do have our resident AI expert on the line today as well. So Ken Cleveland, I don't know if now if you're ready to pop on and just say a quick hi, but Ken Cleveland is on our team. And he has a very strong IT and technical background. And so if you're there, Ken, can you hear me? Oh, there you are. You want to say hi real fast?
Yes.
Just gotta,
Good morning, everyone. Excited about talking AI and my background. I was fortunate to be part of a company that was cloud-based in terms of IT infrastructure, and using AI was central to solving a lot of their problems. And hoping this conversation leads to some of those deeper insights into how things are being implemented and used in today's healthcare market.
Thank you, Ken. I really appreciate that. And so as a member of our team, Ken is helping us work with organizations, design custom tools and figure out from an IT perspective how to implement everything. So great to have him on board. And thank you again for saying hi. So let's dive in if I can. All right. So we're going to start up with the definition because again, I think that lots of people get caught up. There's a lot of language and terms and words that get utilized when we're talking about this. And so what's interesting, and most folks don't fully connect those dots here, is that AI has actually been around since the 50s. It has started way back, really with the scaling of information technology, computing, calculations, algorithms, those types of things. And then in the 80s, we started seeing how systems can start learning from that historical data. This is largely, where the internet came from, is the ability for, code to scan lots of information, identify trends, and then compute results, right? Back in the day, that experience or those capabilities from the 1950s through the 1980s, today we are calling more narrow intelligence. What we've seen with the onset of like terminology and the use of artificial intelligence is where we've been mostly in the 2010s, 2020s, where we started to see the introduction of deep learning, where it could do a lot more than just like output or input-output types of binary responses, and really get into more thoughtful, like analytic consolidation and able to interpret information. This is where we call general intelligence. So there's kind of this advancement. And where we are now today, which most folks are aware of, is really this generative AI, where we're able to create images and be able to create documents and videos and audio files and all of that stuff. And that's a really exciting part, but we're not done yet. We're still early early in this AI journey. And so the next kind of wave, which engineers and kind of the masterminds behind artificial intelligence see as the true frontier, is superintelligence. And that's when you really have autonomous agents, or autonomous software, whether it live in a robot, whether it live in a car, whether it live in an app on your computer, in your phone, whatever, but where they're able to receive inputs, process that information, and then actually make decisions and get to autonomous intelligence. And basically, they'll be able to function without humans being involved at all. And so we're not there yet, right? Like we see stories and examples and things like that, but we are getting there very, very quickly. And so I think that we're definitely at that, axiom point, or threshold, right, where we're going to start seeing this snowball roll real fast. So there are lots of words that are used, to describe or used in artificial intelligence, or to describe different types or components of artificial intelligence. No different than for all of my, clinicians in the room, where it's like, well, the hippocampus controls this, and you have the different brain functions. It's kind of the same thing, right? You've got these various different elements that comprise, the brain of artificial intelligence. So machine learning, as we discussed, is something that many of us are familiar with. It's largely considered, predictive modeling. So based off of all of this, 10 years of history, or 6 months of history, or year of history, or whatever, we're going to run those numbers and predict the next patterns. And patterns are the big element or component of what artificial intelligence is based on. And so understanding that it is looking for patterns in your data, and then looking to understand what would be the next expected end, or the next expected move, input, action, etc. That's how it's functioning. So then when you get into deep learning, this is when it's the way that I just think about this. I'm a visual person. I think of a pinball table, right? And that, input basically goes and pins, or I'm sorry, bounces around all of those different pins to try to understand, is it this, 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 is it this? Based on those responses, okay, now I understand, what I'm supposed to be doing, or how I'm supposed to be responding. It's no different, or it's not largely different from, you're in a walk in the forest and you hear some, leaves crack behind you, right? And you have that, emergency response of like, hey, what's that noise? And you look around, and is it this? Is it just the wind blowing? Is it a bobcat? Is it, a mountain man, coming to get me? Is it a bear? It's the same process, just happening in a computer ecosystem. And then generative AI is where we're moving into, or where we are now, looking at those deep learning models. And so this is where we're starting to see the ability to quote unquote create new content. You can see here at the bottom, AI actually does not create anything new. It is purely pattern replication and modification and adjustment. And so it is not, creating original thought. And I think most of us probably appreciate that. But what it is doing is taking its source content and then creating modifications or alternatives. And so that's really, really important when we start future talking about like bias, and how responses and outputs, may include bias, or may not accurately represent everything, because the data set that AI is trained on is going to bring all of that bias with it, and it's going to bring that bias forward. And so recognizing that AI does not actually create anything new, it is simply a reflection of the data inputs that it has available to it in order to construct whatever image or sound or text file that it's creating. I'm going to briefly pause. I know I've gone through a lot of language, lots of words. Are there any questions? Is anything like overly confusing, or stuff that y'all want me to slow down and unpack a little bit further? You can type in the chat box. I'm looking over at it, or come off mute and just verbally let me know.
Hey, Robert, just a quick side note, more terminology, but artificial general intelligence, short for AGI, is equivalent to that super intelligence you're talking about as the future. And
Right.
so a lot of what you hear today is everyone's marching towards AGI as the future, probably a couple of years out. But just wanted to add that side
Yeah,
note.
absolutely. And thank you. And so at the end of the day, what AI is it is actually not, this wildly new, unheard of, like where did this come from? It is an evolution of, right? And these photos are silly and they're intended to be, but we saw the migration or the evolution of transportation vehicles, right? First there's your feet, and then it was animals, and then it was a horse and buggy, and then we got to a car, and now we've got flying cars, right? They'll be using flying cars at the Olympics next year, which is just wild, right? They're already authorized to fly in Arizona, by the way. And then we saw the same thing with the ability to communicate messages, right? And so if the job to be done is writing a letter, it used to be a feather and ink quill that you would handwrite. And then we got these fancy typewriters. And then we got these computers, and now we're getting supercomputers. The point of this slide is to articulate or to demonstrate that AI is not a replacement. It is a new skill. And that is a central theme that I want to make sure that we are reinforcing throughout today's presentation. The intent of AI, or at least the way we have an opportunity for AI not to cause, massive layoffs or completely disrupt, the workforce, but it is a disruptive tool for the workforce to use. And we have a quote that's coming up somewhere, so I'm going to try not to get ahead of myself. It's actually coming up in the next two slides. So I probably should put those in different orders. When we talk about how AI can build organizational capacity, this is what I was trying to get to. We're not expecting AI to replace humans, right? However, in the workforce specifically, those who know how to use AI will know how to replace those that don't, right? And so this is really an upskilling opportunity. This is really an opportunity for organizations to embrace these technologies, learn about them, figure out how they work inside your organization to increase capacity. And I briefly want to pause because I think what we're seeing in health and human services right now is such a contraction of the market, such a redirection of resources. And I mean, everyone knows like health and human services is hurting horribly, especially in Arizona, and that resources are very tight. We're very resource constrained. And this is where AI creates an opportunity. Like this is a tool that can help us do way more with less, and be able to have an even bigger impact, be able to meet more needs for the customers, the clients, the patients that we're serving, as well as for our staff, giving them new skills and helping them evolve their roles into this new way of working, which is a very exciting opportunity. I personally am extremely excited to see how health and human services evolves. And we're going to go through some very specific examples and use cases. So let's keep going. So as we've learned, AI, not this big scary thing. There is an opportunity for us to really leverage it. And so where are we at today? What's happening on, I don't even know what today's date is, January 9th, 2026, at 12:20 Arizona time, right? So a couple of weeks ago, the US Department of Health and Human Services released their first iteration of their artificial intelligence strategy, their AI strategy. This obviously gives all of us a huge insight look into where is HHS seeing opportunity, and where do we expect them from a policy perspective, a resource perspective, where do we see them going? And so there's a couple of big notes. This document's actually not that long. I think it's about 26 pages, so totally worth reading it all the way through. You don't even need to use AI to summarize it for you, but you can if you want to. But a couple of key things. Secretary Kennedy stated, we want to use Health and Human Services as the template for the utilization of AI. That's a big statement coming from someone that oversees all of HHS. Huge statement for us. They've also outlined a couple of pillars that they are prioritizing or focusing on. And I wanted to really reinforce this because what definitely gets caught up in the noise is there are lots of organizations and apps and companies and people that are promoting and utilizing and pushing and piloting and wanting to build and developing and talking about AI for clinical decision making, diagnostics, assessments, all of that clinical using, there's AI care managers, there's AI medical doctors, there's all of that stuff that exists out there. We've all heard news stories about individuals that are, using AI as their therapist, right? And so there's clinical stuff that is not included in this list. And that's what I want to call out, right? So the direction that we're seeing in the AI strategy from HHS is not to replace clinicians, is not to replace medical doctors or nurses or care managers or therapists or peers. What we are seeing is an operational implementation. So using AI to support the operations of healthcare organizations, which I think is really, really important to clarify. The next thing that really stood out to me is that they have a target to increase AI utilization in health and human services by 70% this year. So when we talk about the runway actually, I apologize, that says 2025. That might be a typo. I would have to go back and confirm. Forgive me if I made a typo. Regardless, a 70% increase in 1 year is huge, right? And so uh, that tells us a little bit about the runway and where and how quickly we should all be looking to implement and introduce solutions. Again, coming from the top. The next thing that HHS released is a compliance plan. And in reality, this is really where we are today. However, it also creates some insight into where and how HHS is looking to utilize AI. And we see it, again, all operational things: funding and procurement, IT infrastructure, product development, operations and management, um, maintenance, data management and sharing, cybersecurity, talent and workforce, right? These are not clinical decisions, these are operational decisions. And so really seeing where and how AI can help support your operations is the best place to start. That's what we're seeing from coming up from the top. And what is the market? This slide, there are like 40 versions of the AI market predictions and where we think it's going to be. So a couple things I wanted to call out here. One is, we are here, right, in 2026. Yes, that is correct. I am oriented to time today. And we're expecting that the market value of AI in 2026 to reach $304 billion. However, in just a couple of years, by 2032, we are looking at $1 trillion industry is what people are predicting AI to be. And so that definitely makes it seem like this is going to be huge, right? But there's a couple of indicators we can use to really gauge where we are now. So for those of you that don't know who Verma is, she was the most recent CMS director under forgive me, she was President Trump's CMS director in his original term. She now does consulting work, and she posted this a couple weeks ago, or about 2 weeks ago, and it really stood out to me because she's working with Oracle on implementing their clinical AI agent. And Oracle is one of the largest EHR, or one of the largest platforms that's out there. They work with hundreds of thousands of customers. And this says they're only using AI in 275 customers. And so I guess my point being is that this is a wonderful enterprise level use case of kind of where big corporations are in the implementation. Everybody is piloting stuff right now, is my point. So we are at the beginning of kind of the deployment here, but it is likely going to happen very quickly once it happens. A couple of other indicators, and forgive me, this later slide's going to get a little wild, but also, earlier this year, the state of Maryland released an RFI basically asking vendors to tell them, how can I take all of Medicaid and turn it into AI agents? This RFI is one of the most fascinating documents I read all year long. And we'll go through some of the use cases that it describes, but it is a state asking technology vendors, how can we translate this capability into literally managing our entire Medicaid system? For those of us in Arizona, I haven't seen, Arizona quite yet go down that path, or I know they've been working on their enterprise, modernization project, and that they are looking to incorporate and embed AI in various aspects and attributes of, what Access is doing here. But this was extremely big and bold. And another example that we're seeing, oh, I don't know if this came up for me and not for you. Oh, no, no. There we go. It just isn't layered correctly. I'm so sorry. So Maryland also just received a bunch of funding to move forward with their AI work. And then we're also seeing, even in the Department of Corrections, that they're putting out and requesting and soliciting vendors to help them with, again, operational types of issues. Another thing that really stood out to me is in rural health transformation funding, there was a lot of talk about AI. And so this is an example. This is from the funding announcement. And again, I know it's kind of hard to see because of all the layers here. But it specifically calls out, the use of technology such as AI scribes and clinical workflow improvements to reduce burdens on clinicians. And so again, the feds and everyone is looking at AI as an opportunity to reduce or eliminate administrative burden, which is going to help us retain our workforce. It's going to help us optimize our workflows. It's going to increase the quality of care. So again, there's a ton of stuff happening in the AI market, but we are not deploying robots today. Right? We're not there yet. And again, with all of the noise and with all of the talk about all the different agents and all of the different technology that's coming out, and everyone's trying to sell you their solution, wanted to kind of bring us down to where we are, put our feet on the ground as of right now, recognizing next month we could have an entirely different story, right? There's new stuff coming out every single day. Just this morning, I saw new announcements from OpenAI, branching into the healthcare sector and trying to build out additional agents and do more workflow stuff. So I also want to take a quick pause right here and see if anyone has questions. The next section we're going to migrate into is use cases. It is frankly a lot of slides with a lot of lists of things on it. And so, just to stimulate discussion and creativity. So, are there any questions, comments? Again, just want to briefly take a pause and check in.
Just
I, yeah.
just a quick call out. The most popular clinical health AI tool is Open Evidence.
Mhm.
And that's the second link I posted. And then ChatGPT just rolled out their ChatGPT Health
Yeah.
model, right? Just in the last day or two.
Yeah, that was the announcement I saw today too. Yeah.
Yeah, really, I haven't looked into it too deeply yet, but I plan to. Open Evidence is being used by a lot of clinicians and the medical side, but that also has a lot of implications and could be, helpful in hedging against, different diagnoses or second opinions, things like that.
Yeah, yeah. Open Evidence is a fantastic resource. I think it's actually included in our resource list. The thing that makes that particular platform unique is that it is only trained on peer-reviewed journals. So it is, very empirically sound and strong versus some of the other models that are trained on Reddit and WikiLeaks, which is less rigorous in its impact. Any other questions before we dive into some very exhaustive lists of use cases? All right. So as promised, again, with all of the noise and all the development and all the agents and all the things that are happening, I think that most organizations, when I'm talking to people, they want to know like, well, what can I actually use this for? What's the development? What's the opportunity? And people are trying to figure that out, right? And so the first way that you can use AI, and this is where most of us have started, and maybe some of us are still here, and that's all right, is as a glorified Google search, right? You can see AI is literally embedded into Google, right? Whatever your search bar of choice, AI is absolutely very helpful at not just providing you some links that you then have to read long form articles and figure out what the answer is, but it is great at like summarizing that information. For some of us, we've also dove into what I'm going to call like retail types of AI platforms like ChatGPT or Gemini or Claude or Copilot or whatever. And these offer a little bit more information or resources that many of us might be using, right? Like uploading a document and having it be summarized or explaining a policy and being able to use like very specific, like create little files and have it like summarize and work on those particular files. All of that is, very, again, retail AI. The next iteration, and this is newer, and it's something that just got released, at least for me, in Office 365 about maybe 60 days ago, not super long ago. But they've now rolled out the ability for organizations to create their own, again, kind of retail agents of sorts. They offer a couple of templates. There's some very useful ones on there. I highly recommend checking it out. And again, like Claude and Gemini and ChatGPT, they're going to have their own iterations of this, right? But using some of these agents, we're starting to move into that kind of generative AI space, where we're relying on that super intelligence of the agent to start actually performing tasks for you. The other nice thing about this platform, Office 365 specifically, which is the one I use most often personally, is you can actually create your own custom agents, right? And that's what we're going to talk about, how we can use some of this. So without having to hire a developer, without having to start a software company, without having to wait on your existing software to build stuff for you, this retail AI creates opportunity for us to do stuff and do some of that stuff faster. So what is some of that stuff? So this is where I'm going to go through. I think it's literally like 20 or 30 slides. I promise. It's a lot. I'm not going to read them all and I'm not going to explain them all, but I will scroll through them, give you a couple of seconds. If you want to screenshot them, go for it. At the end of today's session, I will send out actually like a one pager that has all 100 and something use cases on it. So you don't have to screenshot them if you don't want to, but you're welcome to. But I also wanted to do my best to organize these use cases either in functional roles or in like departments within an organization. So again, as opposed to giving you just like 100 random things, did my best to organize them cogently in specific ways that health and human services organizations might need to interact with this. So let's dive in. So strategy and planning, again, I'm not going to read, but I will, kind of call out a couple and then I'll move on because we got a lot of slides to get through. But again, using data, summarizing, doing analysis, creating all of these things, using it for market intelligence, using it to figure out what competitors are doing, using it even to assess and analyze your own organization. I was at a AI summit a couple weeks ago, and the guy had us all pull out our phones, and he was like, "Go to your favorite AI app, and I want you to insert this prompt. Go to my company's website and then insert the link and say like, and be a critic. Tell me what the customer sentiment is. Tell me, what my hooks are, how compelling is my content, and what is the likelihood that based off of reading my website, someone would want to contact me for services." And everyone did it, and everyone like was aghast at what AI said, right? And so using AI as a tool to kind of help you, think through those things. So strategy and planning, looking at your competitors, great, great, great tool. Looking into regulatory compliance, this is something that we all really heavily, it's overwhelming. It's a lot of information. It's a lot of requirements. They're all disparate. So helping you or using AI to help synthesize, organize, compile stuff. I am really giving it away here. I'm giving away the milk here, y'all. But we use AI a lot when working with providers and with our customers and clients with their permission and consent and notice. But specifically around policy and procedure development, you can upload requirements and have it spit out policies and procedures pretty easily, and then customize it and tailor it to your organization and your workflows. So I mean, you can see there's so much stuff using it. Oh, actually, sorry, this is in the next slide. Quality management or performance improvement, whichever term you use, using it like complex data analysis. So if you've got just a data set, upload that and ask it questions. Tell it what you would ask, like your Power BI people or your quality analysts to do. And of course, allow those folks to use those tools to do those things, helping identify what key performance indicators you should be using based off of your scopes of work. I mean, there's so many things, defining reporting methodologies. You don't need to have a statistician because you've got one, right? Embedded in your AI. And so, and again, even like root cause analysis, like you can upload, the incident reports, and you can upload a lot of the stuff that was going on, and it will help connect those dots and see those patterns and illuminate opportunities. Moving into finance and accounting, and we have a second slide on claims and our revenue cycle management, but specifically around risk, all of these things, predictive budgeting. You can use it to analyze your financial data, tell you about your performance, help it understand where your spending might be off, or disparities analysis and like pay. And again, well, we have an HR slide too, so we'll get there. But there's so much stuff that can be done in finance and accounting. Moving into claims, revenue cycle management. I was literally just on a call, this morning, talking about, payer diversification and timely payment rates and denial rates and how we can improve those things, right? So using AI both to identify and flag those things, because it is very, those of us that work in RCM, like there's always the one person that is, not coding things, fully or accurately, right? And it can help do that root cause analysis and that drill down for you to understand where those revenue opportunities are being missed, or what the hiccups might be, or the trends in your denial reasons, or the persons on your team that might be contributing to your denial reasons, which could be, an opportunity to upskill and send them to our clinical records documentation class. Moving into HR, so many opportunities, and we've got a training and workforce slide after this one. So I try to carve that out, because I know in some organizations those are very separate, and others they're together. But looking at the staffing that you need, the qualifications and the skills, there's a whole compliance component in here that it can manage your credentialing when fingerprint clearance cards are coming due, or expired license renewals, training, all of that. Sorry, training's on the next slide, forgive me. But even things like exit interviews and understanding management feedback, and what can we do to make the employee experience better, to reduce turnover, and all of that. And so many opportunities. Workforce development, really helping us understand what clinician skills are. I know how hard it is for folks to recruit right now. It is very difficult to find talent, folks that have the skills and experience, and want to be proactive and showing up and doing all of that. And so building all of those things into your systems and understanding where those skills need to be developed, right? So we can really invest in the people that we're working on, especially for those of us with big peer-based, workforces, and the opportunity to upskill them and help them do better screenings and assessments and engagement with folks. And there's so much work here. And P.S., it will completely build your curriculum for you, right? So you can identify a topic, tell it to outline, a training curriculum. You can even give it an evidence-based practice, right? And say, like, make sure the training is in fidelity to this evidence-based practice, right? And then it will build slides, and you can even get an avatar to, have AI facilitate the training for you, so it can do it in 47 different languages at the same time based off of the individual who needs it. And that can be for your staff or, for patients and families. Moving into information technology, again, it's funny because like it is itself information technology, but I'm describing like a department, right? Like what would your IT department use AI to do? So like managing inventory of your computers and your equipment, and your depreciation schedules and maintenance schedules, figuring out integration opportunities and APIs to help your data systems talk better to each other, ticket management for your help desk. I mean, again, like AI chatbots to help people self-solve the common IT issues. This is going to free up your experts to really focus strategically, right? If they're not, managing password resets, and now they're able to, really thoughtfully think through what is the technology strategy that we need. Telephone systems. There's wonderful stuff happening in like the customer service space, and having AI agents being able to answer phones, route phone calls, do follow-ups, text message outreach, appointment reminders. All of that stuff is just really, really significant opportunities to enhance the patient experience. And we're going to talk about that throughout this presentation, or at least definitely at the end. Looking at your facilities and management, a million things, right? Again, it's all just data inputs and outputs that need to be managed, right? So figuring out, like for those of you that are building new buildings and doing real estate stuff, like it can help you with that entire building acquisition and build out architectural process, project management, all of that. Figuring out all of the different compliance things, managing your facility walkthroughs so you never have those issues. I mean, even There's apps specific to like landscaping design and having like allergen free or desert friendly plants. I mean, you can really do a lot of stuff. Food safety, course appointment scheduling, internal team scheduling, infection control planning. I mean, there's so many different things. I know some people would put infection control planning and quality management. This is describing, like the very specific like facility, physical plant types of things you would do for physical plant infection control, excuse me. Looking even at like fleet management, tons of different things. Sorry, I warned you this was going to be a lot. I still have quite a few. So I will try to churn through quickly, but also call out important, meaningful things, right? So for those of you doing lots of transportation and driving around, GPS-enabled dispatching and location-based dispatching, mileage tracking, all of the experience for individuals, even building an app, so people can connect almost like an Uber for your own company. Customer service is a huge area. And I think I failed to add my update today, but I meant to put this in here. I posted a couple weeks ago, Deloitte had done a study that they just published saying that Health and Human Services is leaving about $168 billion on the table because it ignores patients. And what it means and what it meant by that article was really it was about customer service. Health and Human Services has been so resource conserved for so long that we don't have call centers for people to just phone up and ask about appointment scheduling, or to have like an orientation, or some of the thing like the general health navigation supports and the things that really make a difference if you were booking a hotel or looking for veterinary care. Many organizations just frankly don't have the resources to have the extra staff, right? This is a wonderful place where AI can really help fill the gap, making sure that your websites are optimized, making sure that, maybe it is that telephone agent, that when someone calls, it can just automatically do the routing, for that person, but in a really engaging, person-centered, human way, not a phone tree, dial 4, and you're stuck listening to this really long message, and that, it's a very different experience. Looking at even, what your patient engagement and like intake process and screening and assessments, like, all of these things can be integrated, they can speak to each other, they can be automated, and you can use AI within your EHR or within, various other softwares you already have today, right? To be able to really dramatically enhance the customer experience. And that can be your strategic differentiator. The difference between, provider A and provider B, this company, have 24-hour customer service. I can call and get my questions answered. They can push me stuff through their secure portal, like all of that. And this, provider B, I call 5 times and I never get a phone call back, and I request an appointment and no one gets back. It's a very different experience. And that experience does drive where people choose to access care. And so customer service specifically, I think, is one of the biggest opportunities for health and human services providers, at least as we're entering into figuring out where AI can help support our organizations. We talked a little bit about marketing and communications. Okay, I promise I have 2 more after this, and then I'm done. We talked about marketing and communications. This is really where AI is proving itself right now. Marketing, communications, and that customer service domain. This is where there's 1,000 apps that are out there. There's 1,000 tools that are really, really helpful, very useful. And so again, looking at all of the different things like your social media posting, internal newsletters, and communication. One of the things that I encounter most when I'm working in an organization, and again, I've worked in about 220 some odd organizations at this point. Internal communication is probably the number one thing that I would attribute to the stress and the challenges that providers are experiencing on a day-to-day basis, because the front line has no idea what the vision of the company is, or what the priorities are, or what the expectations are, what the procedures are, where to access help. There's not an intranet where people can go get their resources. They don't know who to call. That person's no longer here. That type of stuff. This is a huge opportunity to really improve employee satisfaction, which of course will support retention, and also make sure that your entire team is aligned, right? And that's just using it in internal communication. But there's so many other things, again, looking at, website copy, social media, like we think we're doing a good job telling about the work that we're doing. But what is the actual sentiment? How are we coming across in the public? And you can literally ask it that, again, jump in and ask your favorite agent, what is the perception of my company in the community? How am I being perceived? And what can I do to change that message? Super, super helpful. Now, this is where we do get a little bit into clinical operations, but I want to call out again, there is no clinical decision making in this list, right? So clinicians still have operational things that they need to do. And a lot of this is more on the compliance, auditing, workflow automation lane here. And so again, not facilitating screenings and assessments, but managing compliance. Are they completed? Are they done timely? Those types of things. Automating prompts, all of that. Medication management, using it to automate your morning reports or at least take the notes during the morning reports. I think that this is on here, and forgive me if it's not, because like the most easy number one, absolutely, just I wouldn't even think about it. I would just say yes and do it. Is getting AI scribes to help your clinicians with note taking. And again, in the next section that we're about to get into, we're going to go through like governance and setting up, compliance stuff so that everyone, has consents and privacy notices and things like that. But we spend so much time note taking and writing notes and getting our notes in, right? And that is absolutely the number one. If just do it, just embrace it, try it out, start with a small team, scale it, but like that will save you so much time. And it will dramatically reduce burnout risk amongst your staff, because I know everyone experiences folks staying late to get their notes in. And then even, in growth and sustainability, which is something that we do a lot in our firm, and supporting providers is helping them, financially, and then find new opportunities, things like that. And we've been very successful using AI to do a lot of that stuff. And of course, again, we notify our customers when we do that. But lots of opportunities for you to use it as a thought leader or an idea generator and help you inform your strategy as you're developing. Okay. I warned you. I'm very sorry. I did keep my word. That was a lot of lists. Before we enter into our last and final part of today's presentation, I want to quickly pause after seeing all of that long amount of lists. Questions, comments, ideas, things that stood out to you, anything that was new, or you're like, oh, wow, I hadn't thought about that, but that could help me. I would love to hear an example or two. Yeah, Magdalena.
Hi, so one of the projects that I'm thinking about for the company that I work for that is like community mental health
Mhm.
nonprofit organization is performance improvement in the SMI department. SMI is very like high turnover, high acuity, high stress, and sometimes time spent with members. It's needed to improve with productivity.
Yeah.
Do you have any ideas or how I can use the performance improvement of uses
Mhm.
for that aspect?
Yeah, and actually that is exactly what we're about to cover. So I'm going to go through a little bit of governance stuff, and then we're going to dive into like, if I needed to set up an agent, how would I do that if for that very specific thing you're describing? So stay tuned. Any other, before I dive in? I know we're getting close on time too, so I want to be mindful. All right, I'm just going to start running. So this next step is really talking about defining your agency's AI strategy. So we're going to start big and global, and then we'll get to very specific things like you just asked Magdalena. So first and foremost, and I know this might seem obvious, but appoint leadership. And we'll go through this in a little more detail. So, simple 5-point strategy, appoint some leadership. You want to develop some policies, procedures, and training. We're definitely recommending granting access to what we call retail AI. We'll go through that, but your Claudes and your Chat GPTs and your Copilots, whatever solution you choose. Exploring your existing software vendors features. Many software technologies are adding AI to their platforms. And so exploring what's already there. So again, we're not talking about going out and buying something new or building something. There's a lot you can do just with what you already have today. And then if you do have a unique need, or this is where you want to go and become an AI provider in one way or another, then absolutely custom development is an option. And so when we talk about appointing leadership, this can be an individual, it can be a team, it can be a committee. There are lots of different structures depending on the size of your organization and what your compliance structure looks like, your governance structure, your quality structure, management team. You can decide what's best. But their goal, their role listed here, but the ultimate responsibility is really to help guide ethics, controls for safety, privacy, that type of stuff, policies, procedures, and then of course, informed training. Again, you can decide if you need a committee or a team for that, or if an individual can do that. The next thing is setting expectations, right? So policies, procedures, and training. Getting very clear what's allowable, what's not allowable, what platforms, tools are used, what types of decisions are allowed. I know that sounds like a lot. Don't worry. I've drafted some draft policies for you, and we're going to share those with everyone after today's presentation. And then there's some other, simple resources you can use. And we're just getting started, right? So you got to start with the baseline and a foundation, and then allow that to evolve and grow as you continue through your journey. And then, of course, training is going to be big because you need to clarify those expectations and communicate them out to your staff. Fortunately, your AI can write your AI training, which is going to be great. And so when we say, the next step is granting access to AI or retail AI. And so again, this really is about using your vendors of choice. So many of these platforms have free versions. What I am proposing here is actually, making the investment. It's typically 10 to 20 bucks a month per license. And so for your leadership teams, for people that are creating policies, making decisions, need to do analytics, need to process data, those are the folks that I think really need to have access to these tools, because it's going to help them optimize their work. I do not think every peer support specialist, case manager, even clinician or doctor or nurse needs to have the paid access to AI. But for your management and leadership team, and I would even go down to like manager level, right? I don't know if like shift supervisors need it, but management level, I would really consider, how far you're willing to, open up that access, because it's going to help them optimize their work. And this is, a creative process to figuring out where those use cases make sense in your organization to optimize your workflows, of course, to free up your time and to make sure that you're, increasing the quality of care you're providing. And then you want to, once again, you kind of identify your retail tools, turn it on for the leadership that needs it, your management team, policymakers, that type of stuff. I would absolutely be having conversations with your existing vendors. So, these are buckets of types of technology that, Health and Human Services might have. For some people, this might all be integrated. For other people, it might be all tools. Some of you might have never heard of some of this. It just depends on your organization, right? But we are seeing almost every software company is looking at how they can embed AI. And so I would be asking those vendors, not only what do you have today, but what are you building? And if you are so bold, I even saying, hey, you don't have this on your list and I need it. So can you put it on your pipeline? I do that a lot when I'm working with my customers, EHR vendors and things like that. Tell me about your development pipeline, because I want to tell you what it needs to include for us. And we get great receptivity. They really do, appreciate that type of feedback. The next thing is looking at new tools. Now, again, what you see here, there are hundreds, like go on the internet, there's hundreds of these different 30 new AI tools to support your success, right? There's tons of them, but what I liked about these ones is obviously they are like topic specific. So depending on what you're looking to do, content creation, can be policies and procedures just as much as it can be marketing, right? And again, I know I mentioned, marketing, communications, customer service, that is really where AI is shining right now, while we're building it into operational stuff. So figure out which of these might be helpful for you. And again, I'm happy to have a conversation if you want to unpack this a little bit further. But all of this stuff can dramatically change, the capacity of your organization to communicate internally, to communicate externally, enhance that patient and member experience, enhance patient and member education, staff training and education, all of that. And this stuff is here today. It's fully deployable. It's ready. That is not stuff you need to wait for. You just need to figure out how to use it inside your agency. And then when we get to agentification or the development of agents, now, whether these be, your retail agents that you're putting in, your licensed co-pilot that you're paying $20 a month for, or, you get into custom development, which we're going to talk about next. One of the best trains of thought or theories of thought on how do I decide, well, what do I need an agent to do, or what agent do I need? I have come to a place where I think about agents as jobs, like job descriptions. If I have a job description for an intake specialist, it's going to include roles and responsibilities, right? And I should be able to translate that into an agent. I can take that job description, figure out what inputs are needed, and then use it to start training. So thinking about hey, we might not have this position today, but if I were to write a job description to fill this need in our company, this is what it would say. That can be a great starting point for custom development of an agent. And I do need to move a little bit fast, so forgive me here. But this is the answer to your question, Magdalena, right here, is the process starts by really understanding what's consuming the most time. What is your staff I don't want to say wasting, but spending most of its time on that's inefficient, right? That can be redundant processes. Like I just have to type so much in this EHR, right? And that is just taking up 60% of my time is taking notes. It could be administrative tasks. It could be workarounds that they've created because my EHR doesn't have the feature I need. So I'm doing, 32 other things to make sure that I can, get my job done, right? So looking at all of those, high volume, redundant tasks, if they're not super standardized, take the time to standardize them, get some structure behind it. And then you want to document all that in your policies, procedures, program description. You want to get that documentation because that documentation becomes the training resources that you will then train the AI on. And so you need to really understand the process and have it mapped out in terms of inputs, outputs, stuff like that. This is not as labor intensive as it sounds. It really is about making sure, update your policies and procedures, right? Update your programmatic documentation and make sure that it's comprehensive. And then you'll upload it. And then you start training the agents, it will understand those processes, and you're going to fine tune it. So you're going to use it, pilot it. And if it makes an error, you're going to correct it, right? Fine tune it. That's what that process is. And then it's ready to go. And then you'll continue to fine tune it for as long as you go, for as long as you're in operations, because policies will change, needs will change, things like that. And so going back to where do we start? I just kind of wanted to summarize or wrap us up with this last slide. And I know we're just at our time here. But going back to where do I start? This is what HHS has told us. The additional low-hanging fruit is kind of what we talked about, things that, are so AI is excelling in right now. So these are really good places for you to start if you need to. So that was the end of our presentation. Want to say thank you for taking the time today. I will ask that you please take a moment to complete our satisfaction survey. Tell us how we did. If you got your phone, take a quick QR code, scan it. After this presentation, I'm going to send out the recording. I'm going to send out a copy of the PowerPoint. I will send out the use cases, so the list of over 100 use cases for you. And then I also have a draft administrative policy and procedure. So it doesn't get into clinical decision making, but how to use AI in your administration, your business management arms of your company, that you guys can then customize and tailor to your organization. And then I have a strategy checklist that I'm going to send as well that covers a lot of the things that we talked about, getting your governance in place and all of that stuff. So hopefully that offers some real value for you. If you want to chat more about how AI can help you in your organization, give us a call. Ken and I will meet with you. We can help you create a roadmap, define your strategy, customize it, or even build you some custom agents to solve a problem that you're having right now. Any questions, comments? Just want to pause, open the floor. I'll run through some commercials. Again, don't forget, next month, join a mastermind if you want to. Come to coffee next Friday. Volunteer with us on Tuesday. See us next month. All the fun.